from Arizona, Dr. Gosar, for his opening statement.
Chairman Gowdy and Ranking Member Davis and our tireless committee staff, thank you for holding this important hearing today, and I look forward to dwelling into the important issues at hand. And thank you also to our witnesses for sharing and appearing today on our behalf. Almost 1 year ago, the President signed into law what he and the House majority at the time called comprehensive health care reform. At the time, House Speaker Nancy Pelosi said, "We have to pass a bill so we can find out what is in it." As we learn more about this immense piece of legislation, we find it gives unelected bureaucrats unprecedented ability to dictate the parameters of an individual's health care. It also dictates what type of coverage small business owners can offer their employees. Needless to say, there is much cause for concern. Specifically, Section 1001 of this onerous law eliminates lifetime and annual limits on the amount of coverage a health insurer is required to pay. It turns out that millions of Americans use these annual limit plans and are satisfied with them. So the Office of Consumer Information and Insurance Oversight, CCIIO, was instructed by the Secretary to grant waivers to this elimination and therefore allow businesses to continue offering annual limit plans. On March 14, 2011, CCIIO Director Steve Larson, who is here with us today, said, "For the first year, we will set up this fairly straightforward, simple process, and we're now in the process of evaluating the plans out there and what is the best guide path to 2014. I think that today we will discover that indeed the waiver process was not straightforward or simple at all." On March 23, 2010, the so-called Health Care Reform Bill was signed into law. Only 3 months later, on June 28th, Health and Human Services issued an interim regulation creating a Section 1001 waiver. On September 3rd, the agency issued further guidance listing vague criteria through which individuals and employers could qualify for a waiver. On December 8th, HHS finally issued a waiver application. Yet even without this application, HHS granted over 300 waivers. How? What day was the first waiver granted? To date, over 1,000 waivers have been granted to Section 1001, saving 2.4 million Americans from being kicked off their health care coverage. I submit to you, ladies and gentlemen, that HHS has not whatsoever made this process straightforward or simple. Take, for example, on the screen, HHS's website above. There is no provision on the home page for a waiver application, or even for OCIIO, which is now called CCIIO. Or is it EIEIO, which I feel like Old MacDonald had a farm with these acronyms. Let's assume that you are well acquainted with this arduous process to search for OCIIO. It turns out OCIIO has a home page. And if you click to the bottom of that page, follow us along, and scroll all the way down to the bottom left, you'll see regulations and guidance, far from clear to the average Joe, who turns out to need to click right here. Under Regs and Guidance, see Annual Limit Waivers. Under Annual Limit Waivers, there are four, count them, 4 guidance regulations. Good luck combing through those. As you can all see from this demonstration, there's a long way to go and a lot to examine before we can claim to have a transparent, easy process for America's job creators to navigate this law. Add in the cost. Where did the money from CCIIO come from? Was it shifted from our priorities in HHS or CMS's budget, like dialysis centers and other services for the needy and sick? How did these special waivers find their way into the earliest days of this timeline without a waiver process? Were special favors involved? Why wasn't a blanket waiver issued as with other flawed parts of this attempted government takeover of health care? These are a mere samplings of questions I hope you are ready to answer. I know inquiring minds throughout America want and need to know. Thank you, Mr. Chairman.
Thank you, Dr.